Well, it has been 3 weeks since Hurricane Maria ravaged Puerto Rico, but there are now serious questions about the pace of the recovery and the potential for a catastrophic health crisis down the road. Roughly 85% of the island still without power. Food, water, and medical supplies are said to be in dangerously short supply. And while the official death count rose to 45 yesterday, the actual toll is expected to be much higher because deaths in smaller communities, well, they're going unreported. Earlier this week, the White House put out a video claiming the recovery was going well. But what's really going on in Puerto Rico? Here to discuss, former Congresswoman Nan Hayworth, who was also the first female physician in Congress. She's a member of the Trump for President Advisory Board. Welcome back, Nan.
Thank you, Ken.
So when you look at the issues and challenges that Puerto Rico faces, which hat do you put on? Policy Nan hat or Dr. Nan?
Well, both, really, Kennedy, because as a physician, certainly I look and see, as you noted, that the death toll is almost inevitably, unfortunately, going to rise because of the problems that are awaiting them or unfolding because they don't have adequate facilities to deal with those who were already ill before the hurricane hit, and then those who are contracting illnesses because of the fact that their sanitation is impaired and they are living in deeply compromised conditions. Part of this has to do with the fact that Puerto Rico was already in a somewhat chaotic state, especially in terms of its economy and its infrastructure, before this storm
Much
hit.
harder to bounce back when you were financially ravaged to begin with.
Exactly.
And their reliance on NGOs and the federal government have been pretty substantial.
Yes.
And now, even though a lot of supplies have finally made their way, there was a bit of a lag, but they are there.
They are.
It's still difficult getting things from point A to point B, but the most important point B, places like hospitals, running dangerously low on things like oxygen. So what kind of specific health threats could they be facing?
Sure. Well, the biggest threat is from, let's say, emerging threat is from contaminated water, because if you can't pump sewage, if you have standing water, then all kinds of pathogens, from viruses through fungi, bacteria, of course, amoebae, can be in that water. So that is a major problem that will create additional challenges for those who are already compromised, patients who are receiving dialysis, for example, patients who had underlying medical conditions, patients who need oxygen. So they have emphasized many times, their leadership have emphasized that they need to restore their power grid so that they can get
and as we saw in places like
public
Hurricane
health
Katrina,
amenities running.
People who are the most vulnerable, the old and the sick, and those who didn't have a lot of money to begin with, those are the ones who find it impossible to leave the island.
Absolutely.
So they are beholden to the resources they have. So, the White House says that they're doing what they can and making positive steps. Where's the truth? Because it feels like there's a bit of disparity in describing what's going on there. What's really happening?
Kennedy, I think that FEMA has proven itself to be very, very well organized, very conscientious about planning and logistics. And of course, in contrast, in Texas and in Florida, which, yes, are on the mainland, and that definitely is a tremendous help, but their governments were very well managed from the state and local level so that they could provide, because there was, especially in Houston, there was an awful lot of devastation there, and yet recovery has proceeded apace. The FEMA has mobilized lots and lots of resources to send to Puerto Rico, but it's probably true that given their circumstances, they can use ever more. And in fact, the general who's in charge of why are they having
such a hard time with power? I mean, it seems like if the Army Corps of Engineers or, other military and governing bodies deem that there shall be power, there is power. Why is it so hard to light up Puerto Rico?
Well, because Puerto Rico doesn't have the kind of grid that we do in the United States, and they have to rely, obviously, on shipping fuel into them in ways that we don't have to deal with on the mainland.
So and the president has suspended the Jones Act, so it doesn't just have to be
from ships originating from United States ports, which is definitely a great thing to do. But Puerto Rico's needs are vast, and I think as a compassionate nation, and Puerto Ricans are American citizens,
They are absolutely. Can people visit there?
Investment.
I mean, is it possible, like, if people want to be adventurous and they want to be helpful and they still want to go to a beautiful sunny place?
Yeah, well, this probably, I mean, they're going to welcome tourism soon. I don't think now is the time, but any help that people can extend through the Red Cross, through rescue organizations, through Humane Society of the U.S., ASPCA, for, you know, all those who are animal lovers.
Yes, and we've seen the animals making their way to the United States for adoption.
And I help with that, and, you know,
bless the full hearts and loose pocketbooks of those who have already helped out.
Exactly.
And thank you for your insight, Nan Hayworth.
Thank you.
Fantastic.